Well, happy rainy Friday, everyone, and welcome to today's edition of Fun Fridays from the Field Middle School Career Chats, brought to you by NICC's College and Career Connection Program, a member of the Iowa Intermediary Network. Today, we are going to be discussing careers in a vet's office. Thank you to Keystone AEA for being a partner in the creation of the Career Chats. And now on to our special guest today, Connie, and our moderator, Bev. Bev, I'll turn it over to you.
Well, hi, Dr. Connie. So why don't we start off with you introducing yourself and just the role in the career that you have?
So my name is, most people call me Dr. Connie, just because my last name is just a pain to try to pronounce. So I've been Dr. Connie for a while, I'm a veterinarian in Dubuque County. So I have a couple of different jobs that I do. For the most part, I do a lot of small animal medicine, just very general practice. And so, and I can kind of take you through what that might mean. The nice thing is it's a little bit different every day. When I first graduated many years ago, I started in the mixed animal world. So I worked a lot with the cows and the pigs and everything like that. But that industry has changed, and and so the practice didn't stay viable. So I switched over to small animal medicine. I've done some relief work at the Humane Society and such, and that's a different type of practice. And I still like the mixed animal medicine. So I did get my chiropractic certification and my certification in veterinary acupuncture, which I still do on cows and horses. And I did an emu once. That was fun.
Wow, that's super interesting. You work a lot with people. Soft skills are something we talk a lot with our students too. So what are some of those soft skills that are just you have to have in order to work in the career that you have? So
soft skills is a new term. I'm not complete. I've heard it once in a while.
Yep. So like getting tasks done, working with people, showing up on time, communicating is one of those key ones.
Oh, you know what? Communication. I wish I could emphasize how much you need communication skills. And with that goes hand in hand with compassion and empathy. But I tell people, the kids come in and they're like, I love cats and dogs. I love cows. I love this. I'm like, that's great. We work with them, obviously. But that dog and that cat, they aren't walking themselves in on their own leash. There's a human at the other end of that. And you have to be able to gently advocate for the animal while finding out what these owners can do. And that's not always, they're really trying their best. And so you really want to find a soft spot where you can all work together and you have to be fluid. Adaptability is pretty key in this profession. But communication is something that I think they're doing a better job at teaching, but it's also kind of an innate skill that you have the chance to work on now as these kids are growing up. I was working with some 4-H'ers this past weekend, and they're all very quiet and how do you just go up and talk to people? You just do it. You just kind of, once you do it once, you get more comfortable, and I think people appreciate it.
Well, thank you. But what kind of education and training did you have to go through to get to where you're at today?
Okay, so
experiences. That's why. Yeah.
What's that?
You have so many different experiences you've already talked about. Just curious.
Yep. So obviously, after high school, I went to college undergraduate at Iowa State University. And I did that I got into vet school after 4 years. And then I hadn't finished my bachelor's degree yet. I was studying dairy science. So then I started vet school. I slowed that program down a little bit. You can file an appeal to slow it down because I had 2 kids while I was in vet school. And I finished my dairy science degree while I was there, because you always want that. I wanted something to fall back on personally. So, and I think it gives you a little bit broader a broader background. So there was 9 years of education following high school. And then to get my chiropractic certification, that was another 5-month program. I did that about 10 years ago now. And it was 220 some hours of training that we would travel to go and do. And then the acupuncture was last year. And so some of that was online, but again, it's another 5-month program and then an internship to follow and case reports and things like that to get your certification for that. So.
Oh, wow. So the chiropractic program, what does that look from a vet perspective?
From a vet's perspective? Okay, so I get this question a lot. So everybody, you think when you go to the chiropractor, they call it a bone out of place, okay? If it's technically a bone out of place, you're going to a surgeon. I'm not dealing with that. So it's very much an understanding of anatomy and a very strong background in neurology. So how those nerves work, how it gets to the brain, where the spinal cord is, functioning in that, and how little parts of the spine that aren't moving quite right don't tell the body what to do. And so I'm not saying I can cure everything at all. That is not, you'll get some that say there's an innate healing, and that's not my point. My point is to help them move better. So we understand that. We get I was out working on a cow the other day, and the owners were like, so where's the rubber mallet? I'm like, I shouldn't have to, because they've seen that done, and because when you go to the chiropractor and they hit you with the little activator, if anybody's had that, I don't need a rubber mallet. They didn't get hit by a bus. It's very much hands-on in understanding functional neurology. So those are big terms for knowing how the body tells itself what to do.
Wow, thank you for that clarification and how they go together. Also, now that you're in the surgery room, we want to learn a little bit more about the environment that you work in every day.
Absolutely. Okay, so I'm going to try to stay where I get good reception. Apparently, some parts of the office I don't get good reception. So we're going to come over here. Actually, you know what? I'm going to try to switch my camera here real quick. It's not going to let me do that. So we're just going to kind of take you on a tour. Oh, you know what? We have a special treat here today. Walking in right now is Bree from the Humane Society. Remember I said I do some stuff with the Humane Society. And Bree is bringing in a dog for some x-rays. We were just about to walk to the x-ray table.
This is Eeyore.
Eeyore is very wet.
It's raining.
So welcome to the adaptability of our day. We never know for sure what's going to happen. So we work pretty closely with the Humane Society to help them do diagnostics and stuff. So Bree's going to get some picture of a very young but going to be big dog. So
who is also available for adoption.
Oh, big plug. All right, we're going to come over here. This is our surgery suite. We have, so that was a digital x-ray right next to the surgery suite. It's very nice to have it placed like that, because if we do a surgery and we need to double check some x-rays, we can just go straight across to surgery or to x-rays. So in here, we have the, oops, that's not gonna wanna work right. We have the surgery table with a heating element, and we wanna keep them warm, but obviously not too warm. We have a laser unit that we use for helping to, as needed with surgery for clotting and stuff. There's our anesthesia machine. Our techs are absolutely wonderful at monitoring for anesthesia. We monitor heart rate, blood pressure, respiratory rate, do an EKG. Back there in the middle is our ultrasound. So we do, nobody's certified for ultrasounds, but we do use that a lot for like bladder evaluations and things like that. So we're gonna come, bear with me, through swingy doors. And over here, this is where we recover animals from surgery and stuff. We have our dental table, and Ellie is working. Oh, and there's Dr. Adams too. So hi guys. So obviously we're back here in the treatment area. We're going to come up front just a little bit to, oh, excuse me, Angel, I'm going to come through here. Angel and Olivia. Olivia is our high school student wanting to be a veterinarian. And up here we have our exam rooms, pretty straightforward. I'll take you into one of those. A lift table. That makes it easier for bigger patients to get up, and everything we need is kind of in those cabinets for an initial exam. And then we come back here, and here's our pharmacy that we do a lot of work at, a lot of record keeping. I'm not going to take you back to kennels because it gets very noisy, but I'll take you through a doorway. And I'm going to lose reception here pretty quick, but up to the front desk reception area. So yeah, that's kind of our, and the difference is, you know, when I'm working with large animals, you know, that I'm going to go back in here where I have better reception. I work with out of a veterinary truck. And so everything is in one place. So my acupuncture business is, because I have my stuff here and the stuff that I take with me, and that's all in that whole office fits in a bag. So it's a very different depending on what you're doing.
Well, I noticed in that walkthrough too, there's so many people with so many different jobs. So
You bet.
what are some of the different jobs aside from being a vet that could be in your company?
So yeah, and this is a big industry where we need more people. We need more vets too, but veterinary technicians, veterinary assistants, they do so much of support staff. You know, you saw my technicians, they're helping Bree get x-rays. They're helping Dr. Adams get a blood sample or restraining the animal. You know, they're in charge of so much as the restraint. You need a lot of physical ability for, not to necessarily hold them down, but you know, to restrain for safety purposes. So our technicians, our kennel staff, the kennel staff does a great job. They're back there watching those animals that are boarding. And if there's somebody sick, we get notes put up here on the main board and stuff. And then you've got your front desk staff who's really, really, really good at doing triage on the phone. You know, veterinary medicine is almost a different type of language where you really have to get used to things that you don't normally talk about in regular life, and then how to work that. So our vet staff is incredibly important, and it's a great way to still interact with animals and people that way.
Okay, you have to tell us, what is your favorite thing about what you do?
The unpredictability. I'm not a great person with routine. I like having something different to do all the time, and that is a huge perk. But and so I love that you never know what you're going to see during the day. But when I started doing chiropractic and acupuncture, those appointments take longer, and I get to sit and talk with the owners, and you really, really, really get to know somebody when you're in those longer appointments. And I find that I really enjoy talking to owners on a different level. So it's nice.
I don't know if I can ask you this. Was there anything that maybe you don't like about what you do?
That may be what?
Not your favorite thing to do.
So everybody's probably expecting me to say, you know, put an animal to sleep. That is hard. Some of the harder, not harder, but in a different way hard, is having difficult conversations with clients about advocating for their animals. If the animals can't talk, sometimes those conversations can be really stressful. And there's a huge emotional tie to that. And so sometimes that advocating, it's not that I don't like it, but it is a huge challenge.
It really connects to what you've talked about the whole time, just that communication piece and being
bigger than you ever realize.
So those are the questions I have. I'm wondering if there are any questions from the group. So we do have a question in the chat. What is the most exotic animal that you've worked on?
So like I said, I did do chiropractics on an emu once. This past week, however, I was brought in on a case where somebody contacted me that they're raising racing and homing pigeons. So yeah, so I'm currently working through some stuff on a flock of racing and homing pigeons. So it's that's a whole new learning thing, because there's not a lot of books out there on you really learn on the fly there. No pun intended. No pun, but that was good.
That's awesome. So another question is, what type of salary do the jobs you offer at the vet office start at?
So I wish I could speak to what the techs make. I don't know that answer off the top of my head. Veterinarians, depending on what you do, if you look at, I believe, mixed animal, your salary is somewhere, now this was a couple years ago that I looked at this. Your salary for mixed should be somewhere starting probably around that 60 to 70 would be my guess. And then if you are a specialist, if you're internal medicine and stuff like that, you can be well up into hundreds of thousands. So you have a very wide, very, very wide. A regular, just a general practitioner, depending where because in the big cities, you're going to make more than in the smaller towns because cost of living and stuff. So on average, I'd say 80 to 120. Just for small animal. That's strictly small animal.
Sure. So another question is, what classes should a student take in high school in order to prepare them for a veterinary career?
I was thinking about that last night. Let me tell you what I wish I'd studied more in. Foreign language. The world is changing, and I wish I had a better foreign language skill. So yes, your sciences, man, they're going to hammer you with those. You're going to know those. So get your basic sciences. Feel comfortable with your mathematics. We do math all the time. But it may not be classes that you can take, but you're right about the communication skills. If there's any way that you can get out and practice talking to people and volunteer at places and stuff, and just get comfortable talking to people.
So it's not just this, it is the STEM classes, but also your speech, all the different things. What about your work schedule? Nights and we're curious about.
Okay, so like I said, I had 2 kids in vet school. So I knew when I graduated that I needed time for kids. And so when I graduated, I worked, I said, I can do school hours so many days a week. And so it was a struggle to find a place that was allowing that. And as a mixed animal, you can be out in the middle of a call and not make it back to the babysitters on time. So then we also had to find babysitters who said, okay, if they have to stay an extra half an hour while you finish something up, that's fine, just let us know. So I've always had a bit of a different schedule. Now that my kids are older and I'm more in small animal, it's more I'm technically part-time. So 3 days a week, full days are 8 to 5:30. And then on call is usually we alternate weekends. So it comes out to about 1 weekend every 7 weeks on average. So it's not awful, but it could be, I do have a colleague who's doing mixed animal in Ohio, and she's had up to 20 calls in 1 weekend just running, and you don't sleep at that point. And they have backup staff. So that's kind of what and as far as on call, what you get when somebody calls in, who knows? That can be literally anything. So.
Well, I'm also curious about, what do you look for in potential employees for your clinic?
One of the things we look for, punctuality is a big thing. We've talked enough about the communication. That's obviously important. How well you work with other people. We want someone who's a team person and pretty flexible. Like we can multitask a bit. Think ahead. Thinking ahead is something our technicians are absolutely wonderful, and they prep situations, and they kind of say, okay, we've kind of seen this, so we kind of know what we need, and they get it ready. So thinking ahead is pretty critical, but and a big thing, being able to communicate messages in either written form or spoken form. We shift people, between shifts or days. So being able to communicate what needs to be done or what the concerns are. Yeah.
And they have one more question to wrap up our time together. Do you have any pets of your own?
I don't know of a veterinarian that doesn't. So I do have a dog. I have way too many cats. I have a goose who generally lives in a state of anger. She loves to be picked up and pet by us, but she's a better guard dog than the dog. And I also have a bunch of chickens, some turkeys, some guineas, which are very annoying, and peacocks. Yep.
That's fun.
So I'm somewhat addicted to my poultry.
Yes. Oh my goodness. Thank you so much, Dr. Connie, for joining us today. So many great questions we had, even just curious about what you do every day. So
I love what I do.
yes. Stephanie, would you like to wrap us up for today?
No, I just wanted to say thank you, just like Bev did. We appreciate it. And we hope to hear from you again in the future sometime soon.
You betcha.
Have a great day. Thank you.